Welcome to the Western North Carolina School of Massage. My name is Dr. Morgan, and today we're going to learn treatment of the gastrocnemius for neuromuscular therapy to treat calf cramps. The first technique we'll apply is myofascial stretching to the overlying connective tissue. We want to hold the stretch for about a minute because connective tissue is mostly collagen, which are protein molecules, and they respond to mechanical force and heat. And that's known as a thixotropic effect, one of the properties of connective tissue. And after we've held this stretch for approximately 1 minute, we can then do myofascial rolling to the entire area, which is also another myofascial release technique. And once you've done myofascial rolling to the entire region, warming up the connective tissue, seeing where it's pliable and where it's not so pliable, we're going to go back and now address the muscle itself. And if I ask my partner to plantar flex her foot, you can see there's the medial belly and the lateral belly of gastrocnemius. Okay, thank you. So we're going to come in with pincer compression technique to the medial belly, either with opposing thumb and finger or opposing fingers, and explore the tissue, and then come in and compress to mild discomfort. Let me know when you feel mild discomfort by saying just right.
Yes. Okay, just right.
Okay, so now we're just going to hold pressure here and encourage our partner to breathe, and with each exhalation the tissues will relax. And will you let me know when it feels better by saying it feels better?
Yes.
The gastrocnemius trigger points commonly refer to the muscle belly itself, to the posterior knee, and also down to the instep of the foot.
It feels better.
Okay, it feels better. We'll just come out and repeat that a little higher up.
Okay.
Typical overload to the gastrocnemius is due to high heels, walking uphill, or tight elastic ring of socks. Also, a cold chill can overload the muscle. Another type of footwear that can overload the muscle is slick-soled leather shoes, in which the person wearing the shoes has a tendency to tense up these muscles to prevent slipping and falling. Again, this muscle can develop calf cramps from dehydration, electrolyte imbalance, low calcium, magnesium, or vitamin E, and a cold chill. So corrective action would be to not wear high heels, adjust your bicycle seat, wear socks that have a loose elastic band to them, keep your calves warm, and stretch the calf muscle. Then we go on the lateral side and repeat, doing opposing compression, pincer compression to the lateral belly of gastroc
Okay.
to mild discomfort. And you repeat this again here and here. Once you've done compression to the muscle, we can now apply lubricant, and in 3 lines do deep stripping effleurage to the gastrocnemius, 8 to 10 times each line, gliding over the medial belly of gastroc with thumb leading fingers, or use your fingers as a platform and glide your thumb over that platform. You're working where the muscle bifurcates with thumbs 8 to 10 times. Realize you're also affecting the deeper underlying muscles, the soleus, the tibialis posterior, and the deep flexors. And now 8 to 10 times the lateral belly of gastrocnemius with your fingers, palm, and even the thenar eminence. Gastrocnemius crosses two joints, crosses the knee by attaching to the medial and lateral epicondyles of the femur, and then merges with the Achilles tendon to attach at the calcaneus. At the knee, the gastrocnemius performs knee flexion, and at the talocrural joint, plantar flexion. Once you've treated the gastrocnemius with deep stripping effleurage in 3 lines, we can now work the underlying soleus muscle. The soleus muscle is deep to the gastrocnemius, but you can directly access it medially between the tibia and the gastroc. You can roll over the fibers here, right there. So we're just going to come in and specifically palpate and treat the soleus with deep stripping effleurage, stopping and compressing at any areas of tension. The soleus muscle is known as jogger's heel and typically refers pain to the heel, often overloaded from jogging or running uphill or jumping, or again also wearing high heels or anything where plantar flexion is being sustained in contraction. You can also treat soleus on the lateral aspect as it sticks out between the gastrocnemius and the peroneals. Right in here, again, deep stripping effleurage and stop and compress on any areas of tension for the soleus. You can also do a passive stretch to the muscle by using your hand or your thigh and doing a passive stretch with your thigh. And as you passively stretch, applying a broad forearm compression to all the plantar flexors of the posterior compartment. And lastly, we can also then do compression and friction right at the attachment. These muscles can also be involved in plantar fasciitis as they pull on the fascia of the plantar surface of the foot. So coming in here and stimulating connective tissue growth and repair with some deep friction all along the attachment site, all along the Achilles tendon itself, and then even compressing and frictioning along the attachment of the gastrocnemius at the epicondyles of the femur. Nice stretch to soleus, taking the gastroc out of the picture by shortening the knee inflection, deactivates the gastrocnemius and gives a nice primary soleus stretch. All right, and that's an overview of neuromuscular therapy treatment to the gastrocnemius and soleus for calf cramps, heel pain, and plantar fasciitis.